The world is full of dangerous organisms that can make us sick. Bacteria, viruses, and parasites, often called pathogens. To protect us from these pathogens, we rely on two types of defense. The first is our passive defense, barriers that prevent pathogens from entering our body. Our skin is the largest and most important barrier. The second type of defense is our active defense, and its job is to protect us from the pathogens once they enter the body. We call this our immune system. It's an integrated network of processes, mechanisms, and cells, like antibodies and white blood cells, and its job is to identify, hunt down, and destroy invaders. Serious business, and usually the immune system does a great job. Sometimes, however, the immune system gets confused and starts attacking our healthy tissues. This is called an autoimmune response. In some cases, a confused immune system can attack our bones, cartilage, and other tissues near our joints, causing stiffness, pain, and inflammation. This is called inflammatory arthritis, and if not identified and given proper treatment quickly, it leads to permanent, irreversible damage to our joints. So swift access to diagnosis and proper treatment is very important. Inflammatory arthritis can affect anyone at any time from any walk of life. It's a chronic condition, which means it does not go away and will likely require lifelong treatment. The most common types are rheumatoid arthritis, ankylosing spondylitis, and psoriatic arthritis, but there are more than 100 different kinds. While some forms are more common in certain people or at certain ages, it's worth repeating that inflammatory arthritis can affect anyone at any time. Medical treatment for inflammatory types of arthritis is like a balancing act, using the lowest dose of medications needed to control the disease in order to minimize the side effects of the medications. Your doctor may adjust your medication dose and may change or add medications based on your symptoms, a physical examination, and your laboratory tests. There are 3 types of medications in the treatment of inflammatory arthritis. The first group of medication used for inflammatory arthritis is called DMARDs, disease-modifying anti-rheumatic drugs. These work to turn down the immune system's overactivity. By controlling the arthritis inflammation, they reduce joint symptoms and prevent joint damage. It may take a while for DMARDs to start working, usually 6 to 12 weeks. The second group of medications for inflammatory arthritis is NSAIDs, which can help manage symptoms such as pain and swelling. NSAID stands for non-steroidal anti-inflammatory drugs. A coxib is a special kind of NSAID designed to reduce the risk of stomach ulcers, a common side effect of NSAIDs. Both NSAIDs and coxibs help to control the symptoms of pain and inflammation, but they will not slow down or halt the arthritis. You should never take both at the same time. Stick with one or the other. They can be used in combination with other treatments. For some people, they may only be required on an as-needed basis. The last group is a newer class of arthritis medications that are called biologics because they are produced by an organism rather than a chemical reaction. They work by stabilizing your immune system, decreasing its overactivity, and reducing inflammation and other symptoms of inflammatory arthritis. In the process, however, they can also make it harder for your body to fight infection, so special care is needed when you're taking a biologic to ensure you stay healthy. Biologics are usually stopped or held temporarily when antibiotic therapy is required. Some biological therapies, called anti-TNF drugs, target a specific protein that promotes inflammation when large amounts are present. Other biologics target different proteins. Biologics are often given in combination with DMARDs to increase the chances of successful treatment when the inflammatory arthritis has not responded to treatment with DMARDs alone. Biologics will also take time to work. Some people notice a benefit within days or weeks, but for others it may take 3 to 6 months to feel the full effects of this treatment. Biologics can be administered 2 ways, as an intravenous infusion or an injection given just below the skin. For an infusion, a solution containing the medication is delivered through an intravenous line, usually in your arm. Infusions can take from 30 minutes to 6 hours, depending on the medication. You'll be monitored during the infusion, and in some cases for a specific time afterward. Injections deliver the medication quickly and directly by needle into the fatty layer of tissue under the skin in your stomach or thigh. Like any new drug, original biologics, also called innovator or reference drugs, are protected by patent for 20 years. This gives the companies that develop them enough time to recover their research and development costs. When the patent on these drugs expires, other drug companies can apply to Health Canada to make their own version of the biologic. You may think of this as being like a generic version of the biologic, but it's a little more complicated than that. Generics are chemical copies of a brand name medication and function in the same way as the original drug using the same active ingredients. Biologics, on the other hand, are very large and complex molecules produced using living cells, so it is impossible for another drug company to recreate them exactly. These biologic copies are therefore called biosimilars because they are very similar to the original biologic, but are not identical. Health Canada regulations require manufacturers to demonstrate that a biosimilar has a highly similar structure and function to the original biologic in terms of safety, quality, and efficacy, what the drug does, and how well it works. Multiple tests are conducted in the lab to ensure that the minor structural differences of a biosimilar will not result in differences in how it works in the body. Biosimilars have as much or more laboratory data as the innovator biologic, but given the similarity between the two medications, Health Canada doesn't require as much clinical trial data for a biosimilar. Because there is less research and development required to produce a biosimilar, they are usually less expensive than the innovator biologics. This can make a big difference in costs for the public healthcare system, private health insurance plans, and ultimately the person living with arthritis. There's a lot to know and understand when it comes to the many treatment options for inflammatory arthritis. Don't be afraid to ask lots of questions when you discuss treatment options for your inflammatory arthritis with your rheumatologist. Make sure that you understand all the recommendations so you can agree on the course of treatment that is right for you. For more information, visit the Arthritis Society website at www.arthritis.ca.